Hello and welcome back to the channel Ghana University Application Tips, and special greetings to all final year WASI students, and I wish you all the best in your exams and please come out with flying colors. So in today's video, I'm going to explain all the procedures of how the licensure exams is conducted at the School of Nursing and Midwifery Training College for students in Ghana. So the Nursing and Midwifery Council conducts licensing examinations for qualifications as nursing assistants, nurses, midwives every year. And for a candidate to be eligible and admitted into the licensing examinations are those who have successfully completed the required semester theoretical instructions and clinical experiences as stipulated in the rules and regulations for each training program, and must have passed all the examinations conducted by the nursing or midwifery training colleges. Must have also obtained a satisfactory performance in clinical nursing and must have paid the stipulated examination fee for the licensure exams. So what is referred to as indexing in nursing and midwifery? And indexing of student nurse assistants, nurses, and midwives involves the recording of students' personal data into a database to ensure that each student's qualification for admission into the various programs is based on the approval of entry requirements as prescribed by the Council in collaboration with the Ministry of Health. So the process of indexing begins upon receipt of indexing forms from various nursing and midwifery training institutions. Upon completion of the indexing process, students who satisfy all entry requirements are issued unique index numbers which will be used for the Council's licensing examination. And the requirement for indexing is when a student has duly completed the indexing form and paid the prescribed indexing fees. Sitting for the licensure exams. So applications from candidates who wish to sit for the licensing examinations are received by the examination units of the Nursing and Midwifery Council, which coordinates the preparation of test items, obtain examination centers, identify invigilators and examiners, assess examination scripts, and publish the final results. Dates for the exams. So the date for the nursing and midwifery licensing examinations is held annually for the various programs between the months of February, March, June, July, August, and November, December every year. And candidates who pass the licensing examination are issued a professional identification number PIN and a certificate of registration. And for those who pursue the auxiliary programs are also issued with auxiliary identification number AIN and a certificate of registration. Administration of licensure exams. So the Nursing and Midwifery Council administers licensing examinations to all the following castes of nursing and midwifery personnel. Registered general nurses, and this is for those who have undergone a 3-year diploma or a 4-year degree course in nursing in any accredited nursing training institution. And this is for those who have completed a 3-year course in midwifery at any accredited midwifery training institution. Registered community nurse, and this is for those who have completed a 3-year diploma course in community health nursing in any accredited nursing training institution. Registered mental nurse, and this is for those who have completed a 3-year course in mental health nursing in any accredited nursing training institution. Nursing assistant preventives, and this is for those who have completed a 2-year course in nursing assistant preventive in any accredited nursing training institution. Nursing assistant clinical, and this is for those who have completed a 2-year course in nurse assistant clinical in any accredited nursing training institution in Ghana. Licensing and registration. So the Registration Directorate registers nursing assistants, nurses, midwives who have completed their nursing and midwifery education in accredited institutions and were successful in their licensing examination. Licensing and registration. So the Registration Directorate registers nurse assistants, nurses, and midwives who have completed their nursing and midwifery education in any accredited institutions and were successful in their licensing examination. And the registration with the Nurse and Midwifery Council assures the public, employers, and colleagues that a nurse or a midwife has the qualification needed to practice his or her professional skills in any hospital, clinic, CHIP compounds, or any other health centers, is working in a regulated profession, and has not had his name removed from the register for misconduct in or outside the health profession. And at the same time, registered nurses and midwives can practice independently and in collaboration with other health professionals, perform general nursing and midwifery functions, and supervise nurse assistants and other health workers under them. And at the same time, registered nurses and midwives can practice independently and in collaboration with other health professionals, perform general nursing and midwifery functions, and supervise nurse assistants and other health workers under them. So registered nurses and midwives can use their knowledge gained and judgment to assess health needs, provide care, advise, and support people to manage their health properly. And finally, nurse assistants who are healthcare providers and have undergone 2-year training in health assistant clinical or community health nursing programs can provide healthcare to patients or clients under the supervision of a registered nurse or midwife. Procedure and requirements for registration. So upon passing the council's licensing examination, a nurse assistant, nurse, or a midwife is required to go through the following procedure to be registered to practice legally in the country. First and foremost, they must go through the council's regional office and the region in which your institution of training is located. You must present your results slips and letter from the council indicating that you have passed the licensing examination, and you will be required to complete a registration form and pay a non-refundable registration fees. You will also be issued with a log book for rotation and provisional license and code for your national service registration. So after completing the rotation or national service, you will be required to return a log book and provisional license to the regional office where you registered and await your PIN and certificate of registration. And you should take note that the council issues professional identification numbers PIN to nurses and midwives upon completion of the registration process. Nurse assistants are also issued with auxiliary identification number AIN after their registration. So what happens when one fails the licensing examination? Each and every year, thousands of trained nurses and midwives all over the country sit in for the licensure exams in order to work in Ghana. He or she must write and pass the licensing examination conducted by the council at the end of the course before the person becomes eligible to practice nursing or midwifery in the country. But the good news is that in the long run, there are situations where some nursing students who do not pass their licensure exams in the beginning but are allowed to register for resits with their second and third tries until they are able to sail through their exams successfully. So candidates who fail the council's examination are allowed to rewrite until they pass. This means there is no limit to the number of resets. So in case you fail your licensure exams for your first time, please do not give up on your dreams of becoming a professional nurse. Go and do all your homework and come back stronger in the next exam. Thanks for watching, and in my next video I'm going to talk about admissions fraud, how innocent applicants pay huge sums of money to scammers, all in the name of admissions. So please stay tuned and I will see you in the next video.